Hi there, it's Justin Lubino with Senior Advisors. Today's September 10th, 2019. Just wanted to go over the upcoming changes for Part D of Medicare for 2020. We do not have access to all of the plan data yet. That will be available on October 1st. However, there's some fundamental changes to how the Part D components, really the values, work. These values change each year. We try to do a short video that just explains how these values work together and what the changes are for the upcoming year. So this slide here, and you may have seen this from prior year videos that we've done, just outlines the different steps within Part D of Medicare, and it highlights what the changes are for this upcoming year, 2020. So the first step with Part D of Medicare, and these steps, by the way, apply to all 26 of the 30 different Part D plans that are out there. They change each year. But the first step is the deductible. And in 2019, the highest deductible a Part D plan could have is $415. This is going up in 2020. It goes up every year, but it's going up $20. So the highest deductible we'll see for 2020 plans is going to be $435. Now, the way the deductible works, most of these plans for lower cost Tier 1 and Tier 2 generic drugs, the deductible doesn't really apply. So if it's a low-cost drug, you're probably still just paying a couple dollars or even a zero copay for those low-cost drugs. But if you have a higher tier drug, you're going to pay that full cost of that drug until you reach that deductible if your plan has a deductible. We expect there will still be plans. We know there will still be plans that have a zero deductible in 2020. But for the sake of this example, a lot of plans will have a deductible, and we want to make sure we're accounting for those plans as well. After the deductible comes the initial coverage level. And the way the initial coverage level works, it's going to feel very similar to group health insurance or a pre-65 plan where you have a copay or coinsurance for your medication. And a majority of people aren't going to get past this second step. So as long as your drugs cost less than $4,020 based on the retail cost of your drugs, you're just going to stay in this initial coverage level for the whole year, and you're going to pay that copay or coinsurance amount for the remainder of the year. Now, if you have very expensive medications that exceed $4,020 based on the retail cost of the drugs, then that's when you fall into the donut hole. It's also called the coverage gap. And here's where you have to pay 25% for your brand name drugs and also for generics in 2020. So this is where your drugs could get expensive if you exceed that initial coverage level where you got to pay that 25%. Now, only about 12% of people actually get into this coverage gap. So most people, won't even get over the initial coverage level. But if you do have expensive brand name drugs, you will likely hit that donut hole and pay the higher amount for those medications. And I'll show you an example of how this works on the next page after we get through this slide. The next step, if you have expensive medications, is really to protect you so you're not stuck in that donut hole for the entire back half of the year. And that's why they have this catastrophic coverage where you only have to pay 5% or the greater of 5% or $8.95 for brand name drugs or $3.60 for generic drugs. So really, this is, again, to protect you. It's the other side of the donut hole so that you're not stuck in that coverage gap paying the 25% for the whole second half of the year if you have very expensive medications. Now, only about 4% of people actually reach a catastrophic level. And the way you get there is if you exceed $6,350 based on the true out-of-pocket cost. And this calculation can get very confusing, especially because it's apples and oranges. It's apples to get in, which is retail cost to get into the donut hole, and oranges to get out, the true out-of-pocket cost of $6,350 to get to the catastrophic level. So what it includes is everything you've paid for your drugs up to that point in the year, but it also includes the amount the pharmaceutical company is discounting while you're in the donut hole, which this year is going to be 70%. So essentially, you're not really paying $6,350 of your actual money to get into the catastrophic level. Most people, historically, we've seen about $1,500 or so of your true dollars to get into the donut hole, and maybe another $1,500 to $2,500 to get into the catastrophic level. So because, again, part of that $6,350 includes the amount the pharmaceutical company is discounting for brand name drugs while you're in the donut hole. So it's very confusing. I get it. That's why we're going to show you an example on the next slide to hopefully help illustrate this. But before we get to the example, I really want to highlight the change. The biggest change, there's a minor change here of the going from $3,820 to $4,020 retail costs, which is helpful to the Medicare beneficiary because that's going to slightly delay when you're going to reach the donut hole, which you don't want to get to really because that's where your drug costs go up. But there's a bigger change here that is increasing, the time that you're going to be in the donut hole to get to catastrophic by $1,250 true out of pocket, going from $5,100 to $6,350. So we're going to see the impact of this in an illustrative example on the next page. But that's a pretty big jump there for 2020, and the impact it's going to have on those individuals that reach the donut hole is it's going to take longer for them to get to catastrophic coverage than it would in 2019. So let's look at that example so we can see what this looks like. And essentially, we're going to look at it for 2019 and for 2020 so we can see how these things compare. Let's look at 2019 first. This is based upon an example with one medication that costs $955 per month. And this is just if you take multiple drugs, it's really based upon your total drug cost. But if you're just on one medication that costs retail cost of $955, then this is what the model would look like for a 12-month period. So if the copay, this is just illustrative, but if the copay for that drug is $40 and the initial coverage level in 2019 was $3,820, the pharmaceutical discount in the donut hole was 70%, and the member pays 25%, the plan pays the other 5% in the donut hole. And the catastrophic true out-of-pocket limit was $5,100. This is, again, is 2019 example. Let me just drag this up so you can see the tabs at the bottom here. But this is for 2019, is the example we're looking at now. So in 2019, the total number for the year for the individual actual costs for this example will be about $1,574. Now, this includes the initial coverage level, the donut hole, as well as catastrophic level. And this model will walk us through month by month when they're going to reach the donut hole, when they're going to reach catastrophic coverage, and again, that total cost for the year. So the actual cost is just for the first few months is just the copay for that drug. If you remember, it was a $40 copay. So they're just paying the $40 for January, February, March, and April. And then remember the retail cost was $955. So 4 months times the $955, that means they've reached the $3,820 around the end of April. So this is when they've reached the donut hole, and they have to pay 25% for that brand name drug while they're in the donut hole. So their cost went from $40 up to $238 for that medication. And they're going to stay in that donut hole until they reach the true out-of-pocket of $5,100, which is going to happen around October. And that's when their costs will drop back down. October, they're going to hit at mid-month, so they're not getting the full benefit of catastrophic, but by November, they're getting the 5%, and December, they would be getting the 5% of the full cost of the medication. So you can see there's the copay and the initial coverage, and then the donut hole, they pay the 25%, and then when they get to catastrophic, they're going to go down to the 5% of the retail cost of the medication. So the confusing part, in addition, obviously the retail cost, we have to look at the running retail cost to see when they hit the donut hole, but then also the running true out-of-pocket cost to see when they've reached the catastrophic level. And in this example, the true out-of-pocket cost for the first few months is just $40, and the running true out-of-pocket is $40, then $80. We're just adding them up. You get to about $160 there by April. Now, May is when you see the big jump because they're paying a significant portion. They're paying that $238 for their drug, plus the pharmaceutical discount, which is the 70% of that drug cost. So the total true out-of-pocket for May and June and July, they're getting a $900 credit towards a true out-of-pocket. So you see that running total there from May, June, July. It keeps increasing. It's just the addition of the prior months. And you get to about $4,700 true out-of-pocket. Doesn't mean they've spent $4,700. They've only spent a little over $1,300 or so here, but their true out-of-pocket in this example is about $4,700 by September, and they get to the $5,100 at some point in October, and that's when they reach the catastrophic level. So I realize this is very confusing, which is why we tried to illustrate this with just a little model that walks you through the timeline for this example. Again, just a one-drug illustrative example for 2019, and then to see how that compares in 2020 to see what the impacts are. So, the big difference is in 2020, we see the initial coverage level goes up, so that should delay slightly when you reach the donut hole, and then the catastrophic coverage went up significantly. The limit went up to $6,350, so that's going to delay when you reach catastrophic. So if we look at these side by side, 2019 we reached the donut hole right at the end of April. In 2020, we're not going to reach it until some point in May, so that you're not paying the full $238 in May. You're paying a discounted rate because it's a partial month of that donut hole. And then the catastrophic change, instead of reaching it in 2019 in October, we're not reaching it until November. So we're still paying that full cost in October of the donut hole. And then November is almost another full month of the donut hole. We just barely reached the limit in November, so it's a slightly reduced rate. And then December is the only month we're actually getting the benefit of catastrophic in this example. So the total cost for the year, because we're getting a delay of the catastrophic benefit, is higher than in 2019. You'll see $1,574 is what we had in 2019, and 2020 is the $1,816. So let's just make this a little bigger so we can see it. But yeah, essentially it's about $250 more for this example. It could vary based upon your drugs and your situation. And again, only about 4% of people are reaching this catastrophic level. That number may even go down because of this change. So even a lower percentage might reach the catastrophic level. And frankly, a slightly lower percentage might reach the donut hole because that donut hole level went up as well. So, but if you do reach these levels, these impacts may cost even more for those drug costs in this example. So, if you have any questions on this, you can certainly reach out to us at the numbers you see below, or at senior-advisors.com, or email us at info@senior-advisors.com. Thanks, and we look forward to a successful annual enrollment for 2020. Hope you have a great day.